And it's on. Perfect. Welcome, everyone, to Measuring What Matters, developing useful and meaningful indicators. So, my name is Candela Iglesias. I'm a global health specialist, and I'm the founder and director of Alanda Health. For those of you who don't know me, Alanda Health is a social enterprise, and we focus on supporting projects based on strengthening their evidence use, their evidence generation, and their evidence sharing. So indicators are our bread and butter. It's our day-to-day things we work on our day-to-day. So we have tons of examples, and we're happy to be talking about that today. Joining today are 4 people from my team. Julius, who's our project manager, Zamir and Hiba, who are current interns. They'll be supporting me here and making sure I don't miss out on any of your questions or comments. So I just wanted to give a shout out and say thank you. Okay, let's get into this. As I was building this slideshow, I typed in like, okay, give me an image for indicators, and this image came up. And this is basically those lines that you find in many public transport systems around the world, which help guide people with limited vision or impaired vision to their destination. And I just loved the analogy because that's what indicators should do for us. They should guide us towards our destination. Unfortunately, we, as you probably all know, we rarely use them in this way. So we're going to try and think through why is that the case and what can we do better together today. That's what we want to aim for. So I prepped a little bit of a webinar agenda, but we're going to try to, do this a little bit interactively. So I'm going to be asking you to type on the chat to participate, etc. We're going to start talking about why do we care so much about measuring, and then just try to frame it. This causes a lot of confusion, so we'll talk a little bit about it. What's an output indicator, what's an outcome, what's impact. We're going to discuss what makes for a good indicator and how to design good indicators, and then we'll dive into what an indicator card is and how to use it. And I'll close by talking a little bit about Alanda's 3E's evidence framework, which I hope can help you, in your overall work, think about evidence a little bit more, more cohesively across the project cycle. So that's what we aim to achieve today. We'll see how that goes and how much time we have. Please, feel free to start asking questions anytime. There's just like a special chat for questions. Supposedly, this is a very smart webinar, and it's able to move questions from the public chat to the questions chat on its own. But, so it's better if you type them in the questions. Thank you to everyone who's typing in the chat, people joining from Tunisia, from the US, Pennsylvania. So please keep on telling us your name and where you're joining from. This is also about trying to connect us together a little bit better. Okay, so let's dive into why measurement matters. And I think this is different for each of us, so you probably each have your own idea. But for me, it's about data drives decisions, or at least should drive decisions, especially when it comes to health, right? There's many instances where we need to intervene where we don't know what the best strategy is. And that's okay, but there's many instances where we do know what the strategy is. And if we're not using that best strategy, we are failing as global or public health specialists, right? We need to use that evidence. And programs, needs for people that we serve in the communities, in hospitals, in wherever, these needs are going to change. So if we're not measuring what's working and what's not working for our programs, for our interventions, we are bound to get it wrong at some point, just because the fact of that, situations and conditions will change. This is especially true in places where things are changing very fast, such as in conflict settings, etc. So data should be driving decisions. So we need to be sure that the data allows us to make better decisions. And this is something I don't see that often. And then sometimes we put the cart before the horse, right? I mean, indicators can shape what the programs value and prioritize. And we want to make sure that that is the needs of the people being served by this program, by this intervention, not the needs of the donor, even though we all know that we can't just sort of walk away from donor reporting, right? So how do we make sure that the indicators that we choose shape what the program values, right? So that we go in this direction where we want to go. And the opposite is also true. So if our indicators are misaligned, they can negatively impact our results. And I'm curious if they can distort incentives. They can create wrong incentives. And I see this all the time. We do a lot of evaluations at Amanda, and I see so many frameworks that are very heavy with things that people are measuring. And this is people's time. People working in close to the communities, people working in our programs, they're spending time measuring all these things that are not necessarily very useful, or could even sort of damage where the program is going, right? One thing, one example is number of posters created and pasted. Great, but is anyone reading those posters? We don't know. You can have indicators that are actually driving decisions or encouraging the wrong behavior. And I'm curious, have you seen any indicator like this that you're like, whoa, this is not where we want to go, this is not what we should be measuring? So if you've seen an indicator like this, please tap it in the chat. Any indicator that you think is driving or encouraging the wrong behavior from the people in the program, from the communities, from whoever. I think examples of this are very useful to all of us. So start typing in the chat. But from my side, I very recently saw one that actually got me thinking. There was this indicator in a program we were evaluating that was about number of consultations. And it seems harmless enough, right? How many people are your team seeing? But that's not what it's measuring, right? The indicator is number of consultations. So what does that mean? How many people are we actually seeing? We don't know. Are we seeing, are people sort of overusing the service? Are they underusing the service? Have they, like, you might have some people who go once and then never go again. That might signal a problem with your teams on the ground. Maybe they're not providing good quality of care, right? So is this indicator prompting to give too many consultations because it's just measuring that number, as opposed to giving longer consultations with deeper engagement with the patients, etc. So we need to start thinking about what our indicators could truly be measuring, right? If you have any examples that you want to share, please type them on the chat. There are a lot of indicators out there that don't necessarily drive us in the right direction. So I'm curious to hear yours. So the other thing that I see a lot is confusion around, what's an output indicator, what's an outcome indicator, and what's an impact indicator. So the first thing I want to say is, as long as this is coherent as a whole, you don't really care that much about what you're calling it. Your donors might care, your superiors might care, but in practice, as long as this is a coherent framework and one thing leads to the other, then it makes sense, right? So activities, indicators that measure, you have your activities, and when that activity is completed, that would be an output. So outputs are normally numbers, not percentages, and are things as number of people trained, number of consultations, number of consultations given, and you can frame these as in a period of time, of course, right? It can be number of kits distributed for menstrual health. And then several outputs put together are organized in a manner that you think will lead to an outcome. And that outcome, hopefully, is not numeric. Hopefully, it's a percentage that will give you either an idea of coverage or an idea of improvement. So an outcome can be percentage of people satisfied with the service, percentage of people using the service that are satisfied with the service, percentage of women back in school because now they have access to menstrual health kits, for instance, or menstrual health education. So all of these, normally you would try to make sure that it's a percentage, that you have a denominator, so you have some idea around the coverage aspect. Of course, there's lots of outcome indicators that are not percentages or proportions. That's still fine. In some cases, you can't do better than that, right? It could be percentage of households that have access to clean and safe water. And then the idea is that all of these together, several outcomes together aligned, will bring you to whatever it is you're trying to do in terms of impact. This is the end of your destination, right? This is reduce morbidity, reduce number of people falling sick, or children getting measles, falling sick from cholera, percentage of people who have a good quality of life because they have their diabetes under control, right? So it's really the change in morbidity or mortality that you want to do. Morbidity, mortality, quality of life, like this bigger, higher level of things that we're looking at, that we can only change by having an incidence on a number of those outcomes together. Okay, someone's sharing a great example. I've seen this so many times in the world of HIV. I had trouble initially with number of people tested for HIV, as it drove over testing and using up reagents and supplies for testing. So disaggregation added nuance and helped resolve this issue. Yeah, great, good way to solve it. So, it's driving the wrong behavior. Maybe it's better to say, percentage of people seen who actually needed an HIV test, seen in counseling, for instance. Okay, so yeah, we need to think about what we're driving in terms of behavior with our indicators. So back to this output to, thanks. I think it's Henry. Henry, thanks for that excellent example. If you have others, just keep them coming. So back to this output to impact framework. As I said, as long as this makes sense, as long as it's coherent, you might need several levels, right? Your intervention might be very complex, so you might need early outcomes, intermediate outcomes, late stage outcomes, whatever it is. I build it so it makes sense for you, or for your intervention. The reality, and this is what drives so many of our problems, I think, at least in my opinion, is that the more we are towards the output side, the more it's about accountability. Do we really need to be counting every single brochure that we distribute? I mean, isn't this like time wasted for our teams? Do we really need to be counting, how many households do we knocked on the doors? Like, is this what we really care about? A lot of this is a lot donor driven, and we need to recognize that, but we also need to recognize that we can talk, we have a responsibility to talking to our donors, advocating for changing this perspective. What do we really want to measure? What do we really want to count? And the other truth is that down here in the output side, it's easier to measure. It's very easy to count how many people did you see in a day. It's a lot harder to have the right denominators to measure outcomes, and it's much harder to measure impact, because you need like a very strong impact evaluation methodology that it's going to take several years to measure, etc. So it is harder to measure. We can recognize that, but I think there's ways where we can get better at this. And of course, I think, in my opinion, the learning and the improving of programs comes not from measuring at the output level, but trying to push ourselves to measure at the outcome, and eventually impact level. So I think this is where we can try, each of us can try and push the needle a little bit towards the learning and data for decision making side. And then there's sorry. And then there's this story that I like to tell. It's this story that you probably heard before, but there's two people that are in a tropical forest, and they're, one of them is like, and the goal is that they need to climb a tree for certain purposes, right? And one of them gets very excited and is like, yeah, I got this, and starts climbing the tree, and it's like, struggling to climb the tree and to get to the top, and the other's like, no, wait, let's think about it a little bit better. And the other one is still climbing and very excited, and gets to the top, and then says, hey, I'm at the top, I'm here, I made it. And then the person downstairs shouts, no, but that's the wrong tree, right? So I mean, that example to me is like, okay, guys, what are you measuring here? That's the wrong tree. Is that the tree you really want to climb, right? So I think this story is a good way of remembering, always asking the question, is this the right tree? So, okay, let's get into the nitty gritty. How do we design good indicators? And this is my opinion from years of working in this. I think we do a better job when we start with the purpose in mind. What does our program want to achieve? What would success look like? And then we start from there. Instead of starting from, we need to tell the donor that we've distributed this many kits, etc., etc. You might still need to collect that, but where are you going to put the effort? So across that, output to impact timeline, where are you going to put the majority of your effort? And unfortunately, I see a lot of monitoring and evaluation frameworks that are very heavy on the output side, with very little on the outcome, or even, impact is harder, and I understand, but very little on the output and impact side. The second thing is, if you're not co-creating with users, how do you know that these indicators are going to work, that they're going to get collected in the manner that you want them to get collected, etc.? And users mean your frontline staff, the people who's actually going to be measuring this, collecting the data. It also means communities, and it also means decision makers. And you might need a collection of indicators that work, because your decision makers might need different indicators than what your communities want to see. Your communities might want to see, is this working for our communities? Are we getting better? And they might not care so much about the indicators, right? They might be seeing it in the day-to-day, which is great, but it's still really good to involve them. And then the frontline staff, if they're not on board, you're going to have challenges with data collection. And then they can give you great insights into how can you ensure an easier way of monitoring this, an easier way of measuring this, of collecting this data. So I think this is really recommended. I think a lot of us just, sit down and start building our indicators. I see two processes, one person sitting down and writing the indicators on a little bit on their own. And then there's like, okay, some validation at different stages, and that's it. Or the other thing is, a team is creating these indicators, which is already good because you can all brainstorm together on what works and what makes sense, hopefully starting with that purpose in mind. But then there's like a little bit of, this is what I've seen. There's teams where, okay, they built those indicators, they share it with, a board or a group of technical advisors, whatever it is. And then there's a lot of feedback given, and all of that feedback is integrated. that usually leads to what I call monster frameworks. Too many indicators, not all of them measurable. So it's great to ask for feedback. It's great to get other people's impressions. It's great to have some indicators that can be used by different audiences. At the same time, whoever holds the responsibility for building those indicators needs to stand their ground and say, hey, this is too much. Thank you for your feedback. We're going to take these pieces of feedback. This is how we've incorporated them. And these ones we're not taking. This is too much. It's too much for our teams, is not measuring. And you can make that case based on evidence, based on the purpose, based on what's actually, it's actually feasible to collect, right? So it's great. Yeah, there's a balance to have between having too many people giving input on those indicators frameworks, as opposed to having very little people engaged. And having these conversations, particularly with frontline staff and communities, can be really eye-opening, I think. And then the last one for me is to prioritize learning. Can I use this? Is this indicator going to tell me something useful for how can I improve the program? Right. And normally for that, you will need like an actual quantitative indicator and then some qualitative data, which is great. And that's something I actually want to dive into a little bit more in a next webinar. How do we collect qualitative data to improve our programs? But yeah, is this indicator giving me the right data so that I can make decisions about how to improve? Not just to report back to donors. If we can find indicators that work for both, then that's excellent. But let's prioritize learning as much as we can. Let's advocate for that. Okay, so designing good indicators. This is just like a thought exercise about what it means to be designing with purpose and hand in hand with the communities, right? This indicator was percentage of births attended by skilled personnel, and it's very similar to a WHO indicator. We all know that if you work in maternal health. What's the problem with this indicator? What challenges do you see with this indicator? Are there things that you don't like? Tell me in the chat. It seems harmless enough, right? It's a good indicator by all means. Anyone? Say you're a pregnant woman. You're going to give birth. Do you care to be attended by skilled personnel? Yes, definitely. But that skilled personnel could be, demeaning, skilled, but, not very good at applying those skills, could be disrespectful, could be a lot of things, right? So, and then the other thing from a women's perspective, and this is something that is hopefully changing in maternal health, is, okay, this is focused on the number of births. Who is the actual person receiving this care? It's the mother, it's the woman, is a pregnant woman, right? So the way we phrase indicators also matters, right? We need to think about, what does equity look like? What do people want to see? So a team got together to review their indicators, and this indicator they actually rewrote in this way. They had like a list, like a checklist of questions to drive their thinking, and they ended up changing it to percentage of women receiving respectful, evidence-based care during labor. It's not just enough that people are skilled. Are they using what we know are good practices during care? And it's not just about receiving a service. It's about whether, we would come to this service again. The thing is, the first one, it's easy to count, right? Like if you in your hospital you always have qualified nurses or midwives or doctors, then it's sort of like, okay, every birth counts as for this, counts towards this indicator. Easy peasy, check. The second one is it's harder. What do we need to do in order to measure that second indicator, the after indicator? Someone's typing. Exciting. I love it when you type, guys. Respectful is tricky because it's subjective, so it would be to need to be clearly defined. Absolutely. Who decides whether that treatment was respectful or not? The person receiving the care, right? So the thing is, the first one you can measure just with checks in your in the hospital. The second, you actually need to have a short survey or ask questions from the woman receiving care, right? You would need qualitatively data, survey, potentially validate the questionnaire. Absolutely, yes. A feedback form, it can have 2 questions. It doesn't have to be anything long. But then you're actually saying, yeah, okay, if a woman ticks all of these cases, then she considers that the care she received was respectful. Or you can just ask the question, was, on a scale of 1 to 5, how respectful was the care that you received? And you can define the indicator as, women answering very respectful or respectful count towards this indicator. That's fine. So there's still a little bit of thinking, but the way of measuring will change dramatically. So I think, having these practical examples really helps. Okay, so let's say you have a bunch of indicators. How do you look at them and say, okay, how good is this indicator? Can I, do I have a little checklist to go through them and say, okay, check, 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 this is good. This is something for those of you joined in the previous webinar, we covered like, okay, a vague indicator, and I see this so much, is worded in this way: community well-being improved. That's not specific enough, right? A specific indicator would look like, okay, what are the characteristics of, improved well-being in a community? Who defines this? The community. So you go build those indicators with the community. What do they care about? Well, it turns out they care about having access to safe drinking water, nearby, so that they don't have to walk more than 10 or 15 minutes. Great. So we use that to build an indicator that drives that, right? Percentage of households reporting access to safe drinking water in the last 30 days. And then you would potentially need, like a baseline, so that that percentage is increasing on year 1 of your program, on year 2 of your program, on year 3 of your program, and at end line. How many of you, like, if you can click on the little like thumbs up icon if your answer is yes, are you familiar with the SMART framework for indicators? Yes, so quite a number of people are familiar with the SMART framework. Not everybody has answered, so I'm still going to go through it. I'm not a super big fan of SMART, to be honest. I know this is like, it's not something you're supposed to say. I think it's too complicated. I think if you're going to sort of like, I did this years ago, I did this for every single one of my monitoring and evaluation frameworks. I would have columns on my Excel sheet for S for specific, M for measurable, A for achievable, R for irrelevant, T for time bound or for timeliness. And I would actually check against all of that. I think that's overkill. I think you can very quickly, if you're focusing on purpose, figure out whether your indicators are good or not. If the SMART framework works for you, great, use it, right? S for specific, M for measurable, A for achievable, R for relevant, T for time bound, right? So here, for example, specific, percentage of households reporting access to safe drinking water. Much more specific that, this vague community well-being improved, right? Measurable, yes, I can measure it. I can go house to house and count the number of households that say that they have access to safe drinking water. You can write like you can have a yes and no question. You can have a more detailed like Likert type questionnaire, and say, okay, I'm going to count as yes those that strongly agree or agree with this statement. So you can measure this in different ways, but definitely measurable. Achievable, I think for me that's on the target. What target are you putting on this, right? Yes, I mean, I think this is achievable. You're probably going to be able to see a change in this if your program is aligned with increasing access to safe drinking water, right? Are you measuring, are you climbing the right tree? Sorry, excuse me. And then relevant. I'm not sure the word relevant is the word I like most. I like meaningful. It's fine, whatever you choose to use, but does this indicator tell me, is this measuring, first, is it measuring, for me, relevant, is it measuring something useful for the communities? Are we on the right tree? And second, does it tell me something useful for action? And someone mentioned a little bit before, disaggregation. It might be that it's not telling us anything useful for action because it's not disaggregated enough, right? So make sure that relevant or meaningfulness, or whatever you want to call it, has those two aspects. It's aligned with your purpose, with what the communities, what you see, or what the people you're serving want to see. And it's telling you, hopefully, not all of the indicators, some might be very results oriented, but others need to be telling you how to improve, helping you say, okay, there's a problem here, how do we improve this, right? Okay, quick check-in from the SMART. S for specific, M for measurable, A for achievable, R for relevant, and T for time-bound. This one, oh, I forgot the time-bound, sorry. It says in the last 30 days. I see a lot of indicators with this problem. Okay, you need to compare apples with apples, right? Or papayas with papayas. Basically, is this being measured by your different teams in different locations in the same way? Are they counting for a month? Are they counting from the 1st of the month to the last day of the month? Or are they counting from the 5th of the month to the 5th of the next month? Like, all of these things enter in the time-bound one, right? Exactly how you're measuring, exactly what time period is comprised. So it's not just enough that it's time-bound, it needs to be the same timeline for everybody, okay? And I know it sounds so basic, but I see so many of these mistakes made again and again. So yeah, question, which of the SMART components have you seen is most often ignored in your context? Specific, measurable, achievable, relevant, or time-bound? Type in the chat. Relevant, yes. August, yes. To be honest, that's the one I care most about. Too much focus on output, someone's saying yes. Yes. And to be honest, do our donors care so much about output? Do they really want to be checking that you distributed every single one of your kits or brochures or whatever? I think if we have a good discussion with them, we might, they might also want some other type of indicators. Time bound, yes, a lot of like, oh yeah, actually, measure this, but we don't know in what time we need to measure this. Great, thanks people. Keep them coming. Okay, so now we are going to delve a little bit deeper. This is, oh, sorry, you're not seeing the same thing as I'm seeing. There you go. I see, I can't tell you how many indicator lists or monitoring or evaluation frameworks that don't include indicator cards. There's only so much information you can put into an indicator. I really, really recommend that at least for your key indicators, you take time to develop indicator cards. It's a lot of work, but this is, where the rubber meets the road. This is where, we get into the nitty-gritty and ensure that everybody's measuring it the same way. What does an indicator card contain? There's more fancy ones, there's simpler ones. I just try to put what I think is sort of critical. If you have other things that you believe are critical, just type them in the chat. But it can contain the level, so we're using this at the output level. And I think the most important thing is, why are we collecting this? And just having this in the indicator card and having that discussion might already help you take out a lot of indicators that are not necessarily very useful for your purpose, right? Why does the indicator matter? What decision does it inform? So this actually, writing these indicator cards as a team really helps to say, okay, it refocuses people very strongly. Then the definition, and this is for real, right? Sometimes we go in for an evaluation, and we go into to the community, and so on. It's like, oh yeah, great, this indicator from the donor framework, how are you measuring it? Oh, we're measuring it this way. And you go to another location, they're actually measuring in a totally different way. This is where indicator cards come in. You have the definition with what is the numerator, what is the denominator, what is the calculation method, what is the time period, every single little detail to ensure that everybody's measuring it in the same way. Now, it's great that you have the indicator card. Are people actually reading it? So one trick I've built over the years is, when you're actually doing this work with your frontline staff, you ask them, where do you collect data? What does your data collection tool look like? When are you collecting data? And you look at that, and then you try to embed these definitions there so they see them when they are collecting the data. This can be in a computer, this can be in an iPad, this can be in a tablet, this can be on paper, but wherever they're actually, what instrument they're using to collect this data, the reminder needs to be there. If it's somewhere else, like if it's written in, a bunch of cards that are sitting there in a desk gathering dust, it doesn't matter if you have a perfect definition, it's not going to be used, right? So that's, those are the little tricks that actually can drive behavioral change. And of course, training, lots and lots of training, but having the reminders at the right place, I would say. Okay, the data source. Where is the data coming from? Is this coming from a routine system? Is this coming from a survey, as in an example that we saw before, like a feedback form? Is this coming from, the sheets that our volunteers are collecting when they go house to house? You need to put that very clearly. And what I see in data source, and I'm sure many of you have this experience as well, is like, we put something there when we first wrote the indicator cards, but because we didn't consult with the frontline staff, this is absolutely not the right source of data. Like, we're actually with a totally different instrument, or the source of data is totally different. So we actually need to build this together with the people collecting the data, so we're all aligned on what is the true data source. And then the frequency, how often the data is collected and how often it is reported, and these two do not need to be the same. You could be collecting it weekly or daily and then reporting it every month or every 3 months or whatever, right? So they don't need to be the same, but specifying that can be important. This is particularly important because I see a lot of times where data is only sort of collected or aggregated when reporting is coming. A better system to sort of pick up on errors quickly is, if we're actually gathering the data daily, then that local team, that team at the front line, can make sure that it's aggregated daily, hopefully in an automatized manner, and then look at it every morning for 5 minutes and say, hey, this is what we saw yesterday. What do we need to take into account? So this is what we saw last week. What do we need to take into account? And then we don't wait until reporting time to aggregate it, because by reporting time, we might have forgotten that, yesterday a lot of people were not able to go out to the communities because, the roads were impassable, or there was a lot of rain, or whatever it is. So, try to prompt the advantages of memory in your frequency for data collection and aggregation as opposed to reporting. And then disaggregation. Let's talk about categories for disaggregation, people. This is a big one. I think it's a big one for all of us. Okay, what are the most common ones? Can you type in the chat? Or what are some that you would like to see included and they're not usually included? Age and sex, definitely, yes. The most common ones. And again, you know, one team is collecting age disaggregation as, you know, plus under 5 and over 5. Another one is collecting up to 18 years old. You know, it has to be the same categories. So when you write this indicators card, you don't only put the variables which you want to disaggregate by, but also you put the categories for disaggregation. Otherwise, it's going to be all over the place. Income band, that's very useful if you have the data. You can have some, like, you know, proxies for income band that you could use at a community level, for instance. Like lately, I've been working on we've been working on an evaluation around that, where, you know, they were looking at different groups for different folders. But it's like, okay, great. How do you find people with disabilities? Right. So we need to understand what categories, not just what variables we're disaggregating for, but what categories are we including? Is it mobility challenges? Is it people with limited mobility? Is it people who have impaired vision? Is it people who have impaired hearing? What are we counting in that category? People are also writing ethnicity case. Yes, it can be very variable depending on the context you're in. We also need to be very sensitive to what people are comfortable or not comfortable disclosing, and whether, you know, there might be issues of safety that we need to be aware of. So yes, for disaggregation, what do you, it's again, it's about your purpose. What do you care about? What can tell you what needs to change, right? Someone was saying, you know, that you were overusing HIV diagnostic tests. Can you make sure that, you know, there is a decision being made about who should receive an HIV test? You could include a category related to that, a disaggregation related to that. So think smartly about how you disaggregate your indicator to ensure the right coverage, the right people being reached, etc. And then interpretation, and this one's whenever I review indicator cards, I see that sometimes people have a lot of challenges with this one. That's okay. I think that's partially because we tend to work on our little corner instead of sort of putting together teams to work on this. What's the guidance on the meaning and, you know, potentially the limitators of the indicator? But for example, okay, if this indicator is going down, you need to go back to your patients and ask this questions, or use this qualitative survey, or, you know, go and do some direct observation of what is happening. So what does it mean if the percentage of women saying that they receive respectful and evidence-based care at labor is going down? What can that trigger? Additions does it inform? For that interpretation, then are you really going to be using this for decision making? Are you really going to be using this to tweak your program? It might not be, you know, at the impact level, you might be, if you're measuring impact, okay, these are our results. But, you know, most of the time, for monitoring purposes, this is what we want to see. How, if this indicator changes in this way, what actions should that be triggering? If it changes in the other way, what actions should that be triggering? Here's an example, not necessarily the perfect example, but just an example that we can look at together. Indicator title, percentage of women receiving postnatal care within 48 hours. Great. Why? Because we want to monitor timely postnatal care and identify services gaps. To me, that part is a bit vague, right? And this is where the interpretation might help us. Definition, numerator, denominator. Okay, does it tell us how to do the calculation? So there might be some, if you're looking at this and you're seeing, oh, I would add this, or I would, explain this, just type it in the chat. I think thinking about how we can improve this definitely helps. Percentage of women receiving postnatal care within 48 hours. Denominator, number of women who delivered in the last 12 months. Here is where it gets tricky about when you collect the data as to where you report the data. You might want to have different denominators for both actions, right? And that depends on whether your indicator cards are being used for reporting or are being used for monitoring in the this is a bit vague. I don't, it might not be that you have it very clear. Frequency quarterly, this is the frequency. Is this the frequency of data collection? Is it the frequency of reporting? Disaggregation by age, okay, but what are your categories? By location, okay, what is the location? Is it the name of the healthcare setting, the name of the hospital? Is it the community? Is it the neighborhood? Like whatever it is, it has to be, you need to tell the people exactly what these categories are going to be. And socioeconomic status, the same. This can be defined in many different ways, right? It has to be clear for everybody exactly what the categories are going to be. And who's the responsible party? You notice that I had not included that. I think you can, but yeah, just make sure that you're creating these indicator cards for your teams as opposed for the people in charge of reporting. And then interpretation and notes. A decrease in this may signal reporting delays or service accessibility issues. Okay, reporting delays. What are we going to do about that? Service accessibility issues. What are we going to do about that, right? So then what actions should this trigger? And I really like to ask that question. Unfortunately, it doesn't necessarily trigger actions until an evaluation is carried out, but we would like to see more of this during monitoring. Great, so I hope you're using indicator cards. If not, I challenge you to grab one indicator that you're using these days and trying to build that indicator card. It'll just sort of flip your thinking a lot, hopefully. I'm going to stop talking now because we have 10 minutes to go and just open it up for questions. What are you struggling with? Happy to answer questions, or at least we can brainstorm together. How do we co-create indicators with communities? Tricky, but you can, right? When you're doing a needs assessment, for instance, and hopefully you're doing needs assessments for your programs, you can use this opportunity as a first step in asking about what the communities care about, what their needs are, and so on. And you can bring this information to when you're creating indicators, right? And then at some point, if you have the possibility, you can go back and create focus group discussions, other qualitative methodologies to bring people together and say, hey, does this resonate? This is what we would be measuring. Is this something that you care about measuring? What else would you care about measuring, right? So there's a possibility to do that. But even if you are not able to, if you did a good needs assessment and you keep the data for your needs assessment in mind while you're building indicators, that's also already a pretty good step. When you're working in hospitals, for example, I think this becomes a lot easier. You can go back to your patients, you can go back to their carers, and you can go back to the hospital staff, not just the clinicians, but also your administrative people who are actually doing like the data inputting or the data collection, or sharing the forms. Whoever is collecting or looking at the data should have a say. Especially in communities with low literacy levels and restrictive gender norms, what kind of methods do we use in such contexts that can retain participant autonomy and safety? There's ways of doing this. That would take like a whole other webinar, and I'm not an expert. But we can definitely bring in an expert at another time to talk about this. Some ways I've seen that I particularly like is ongoing community women's groups, for instance, that are tied to different things that are holistic in nature, right? Like they're about economic empowerment, but then it's also a safe space because they're all together to talk about sexual and reproductive health. So then, when it comes to communities that have very specific norms related to gender, it can get very tricky. So how can we be respectful while still changing norms, community norms or social norms that are harmful for the women, because that is the goal, right? To improve the health. So having these groups of people from the community, having people from the community moderating these groups or leading these groups. You can have when you're building focus group discussions, you can think about having groups for men, groups for women, groups for young girls, groups for young boys. So you can build these groups so that they become safe spaces, right? Any other questions? Let me see. Okay, there's a question from earlier. How do you differentiating outcome from impact? Normally, impact is something that you measure at the end of a program, right? Or over many years. This is our changes in morbidity or mortality or quality of life. That's sort of like the big line definition. At the same time, as an evaluator, I don't care as long as your framework makes sense. If for you impact is a lower level than that, it's it's measured as satisfaction with a service, it's measured as increased access to safe water because we know that will reduce cholera. You don't necessarily need to measure reduced case of cholera. You might just be, there's enough data to say that if we do A, B, and C, we will be able to reduce cholera, right? So as long as your framework makes sense, I don't think it's that's the most important thing. Instead of focusing so much on whether it's outcome or impact, does my series, that the aggregation of these actions, do they make sense? Let me see. Would you typically want the time period in the denominator to align with the reporting frequency? On the previous indicator card, they were different. Yes, that's a very good catch. And that's what I was saying. I think sometimes I see indicator cards that are made for reporting, but they mix in aspects of data collection. So you might not need exactly the same card for the people who are reporting, because that time frame might be different. And the aggregation that they might need to do might be different, as opposed to the people who are collecting the data. What indicator card is for the people who are collecting the data? This will be people at a single healthcare facility, at a single department in the healthcare facility, and they might be collecting this data every day. Do you want to aggregate it by day, by week, by whatever, right? So it might look different at that level, as opposed to your reporting team, your data analysis and reporting team, who's getting those indicators from all the healthcare facilities in your program, and it's aggregating that data. So their framework might be different, right? So I see a lot of sort of confusion about these two things that I think is driving that unclarity in many indicator cards. Great, we have 4 more minutes. I'm not familiar with the use of cards. Is this a method you teach or something required by clients at the Atmos or you operate? Indicator cards should, in theory, be part of any strong monitoring and evaluation framework. So a monitoring evaluation framework will tell you how are you going to be measuring things. on a monitoring basis for the midterm or end evaluation. What are you going to be measuring? And when it's a strong one, it usually contains indicator cards. To be honest, a lot don't. You just have this list of indicators at the different levels. So building good indicator cards, and you can Google this, there's plenty of good information out there. You can build these indicator cards, and as I say, you make sure you build a set that is for your data collectors, and potentially a set that is a little bit different for the people who are reporting on this data. Okay, great. We have just a few more minutes, so I wanted to just wrap up quickly. Take-home messages. Think purpose and equity when you're building your indicators. Focus on use, not just data collection. Involve those closest to the data. They know what's feasible to do, what's, and how can you make it less data. And we can think about it working. There you go. I like to leave you with the way we look at evidence across the project cycle at Alanda. And, we're trying to sort of pick and choose little pieces of this whole evidence framework to talk about during our webinars. The way we support the organizations we work with to strengthen their evidence is with this framework. So this framework focused on, do you have the right evidence for starting your project? Needs assessment, literature reviews. Is your project based on the best available evidence of what works and an understanding of your community, the communities where you're working in, right? This is at the concept and design stage. And then evidence generating. Are you measuring the right data to show impact? I think this webinar is very focused on that evidence generating. Are you generating the right data to measure and to improve your program as you're going on, and then to show impact and to show, real change? And at the last step, and this is a step that I think most organizations are not there yet. Most organizations are very good at the first part, the evidence base, variable at the evidence generating, and then the evidence sharing is the piece that gets forgotten. So at Alanda, we support organizations to conduct evaluations, but also to conduct learning processes. Evaluation reports can be 100 pages long. No one's going to read that. How do you bring that information back to the communities, back to your frontline staff, back to a variety of different audiences, to other people working in the same space? So how do you do that evidence sharing? So we also support organizations working on this. So if you want to talk about how to improve evidence use, evidence generation, or evidence sharing for your own organization, you can book a call with me. My team will put the link for that in the chat, and you'll have it in the email that you will receive tomorrow. If your organization wants support in improving their evidence, book a call with me. We're always happy to chat about this. Thank you so much for being here. It's always lovely to have so many people interested in improving their monitoring and their evaluation. And yeah, we'll probably do one last webinar before the end of the year, so stay tuned.